Hello, I'm Dr. Joel Brook, founding partner of Dallas Podiatry Works. We treat athletic and overuse injuries here on a daily basis. This is one of our passions. We feel that if our patients are striving to have the healthiest lifestyle they can, it's our job to be sure that foot and ankle pain is not coming in the way of their training. One of the most common athletic injuries incurred are sprains. Turf toe refers to injury of the soft tissue surrounding the great toe joint. Sprains are bad injuries involving partial or complete tearing of ligaments or capsules surrounding the joint. Patients who are told that their injuries are just a sprain are not being alerted to the potential severity of the injury and need for aggressive treatment. With regard to ankle sprains, the ligaments surrounding the ankle contain nerves that allow your brain to know where your foot and ankle are in space. Tearing of the ligaments damages these nerves. If not appropriately treated with early activity, physical therapy, the patients can develop chronic instability and repeated re-injury of their ankle. Injuries also occur to the bones of the foot and ankle, which can be debilitating. Fractures can occur with a fall or direct blunt trauma. Stress fractures typically occur when bones are subjected to abnormal stress, often occurring with the addition of a new or more rigorous exercise routine. Diagnosis is made by history, clinical exam, and a series of x-rays which are taken over a period of time. This is because stress fracture findings on x-ray are not always present in the initial presentation for treatment. Management of fractures will involve immobilization in a surgical boot or shoe, modification of activity level. These will allow the bone to heal. Surgical intervention is rarely necessary. Remember that if injured, institute RICE protocol: rest, ice, elevation, and compression. Contact us for early intervention so we can get you back to your pre-injury level at the soonest possible time.